Dr. Gail Frazetta is a board-certified family medicine physician in Montrose since 1998. She has advanced specialty training in hormones and osteoporosis management. She has been an advocate for hormone therapy her entire career and gives lectures around the country on the subject. She is the 2019 Humanitarian of the Year for the state of Colorado, presented by Copic Insurance. Last weekend, she was a guest speaker at the annual conference of the Colorado Academy of Family Practice. Her presentation was titled Menopause, Myths, and Medicine. A presentation, if you'd like to see it, you can also see in September in her Sherb Talk. She also presented her research on bone mineral density changes using testosterone in postmenopausal women. Ladies and gentlemen, Dr. Gail Frazetta.
So, breast cancer is the main topic today, but the cause of cancer in general is unknown. There are multiple risk factors that occur that increase people's risk for cancer. There is not a single known cause. Similar to climate change, you wouldn't have a single cause of climate change. So if you look at this list, it is all-encompassing. But for instance, sun exposure. Lots of people get sun exposure, but not everybody gets skin cancer. Similarly, genetics play a big role, but not everyone with bad genetics get cancer. So for breast cancer, what is the single largest risk or biggest risk for getting breast cancer? It is the most feared. It is the most common. Any answers? Anyone want to guess what the single biggest risk is for breast cancer? Right. So, however, but it's women having breasts, right? So the single biggest risk factor is in fact being female, because men have breast tissue, yet they account for only 2% of breast cancers. So you're 100 times more likely to get breast cancer as a female compared to men. The other risk factors to consider are age. The older you get, the higher your risk of breast cancer. So if you think about it, a menopausal female loses estrogen, yet despite that, she gets higher and higher risk of breast cancer. At menopause, her risk is about 1 in 42. If she lives till 80, her risk is 1 in 26. So the longer that female went without estrogen, the higher her risk of breast cancer actually has become. So a 70-year-old male has, in fact, more estrogen than a 70-year-old female. So why aren't men getting breast cancer at 70 instead of females? But they don't. It's because estrogen does not cause breast cancer. Genetics, BRCA genes, 1 and 2, they code for proteins that repair damaged DNA. If you have these genetics, you have an 85% risk of getting breast cancer, but not 100% risk, because it's a little more complex than just genetics. Estrogen exposure. So if in fact estrogen caused breast cancer, the more exposure you had, the higher your risk of breast cancer should be, similar to radiation, right? More radiation, more problems. However, clearly, it's not the case. Young women have lots of estrogen. Their levels are between 200 and 300. So if it tracked that estrogen caused breast cancer, then young women should be getting breast cancer, but in fact, they don't. Pregnant women, their estrogen levels are about 4,000. So if estrogen caused breast cancer, then pregnant women should very simply be getting breast cancer, yet they don't. And in fact, if you get pregnant before age 20, you have a 70% lower risk of actually getting breast cancer. So women who actually get breast cancer and get it treated and choose to get pregnant, remember 4,000 is that estrogen level, they don't have a higher risk of getting breast cancer again or at any time in the future. There is no difference getting pregnant after breast cancer. Women, because of this misconception that estrogen is bad, they were offered pregnancy termination if they got if they got breast cancer during pregnancy, and ultimately was shown that terminating that pregnancy had no change in that woman's outcome in surviving that breast cancer. Similarly, women who were premenopausal getting breast cancer had no improvement removing their ovaries. Estrogen, in fact, used to be used to treat breast cancer. From the 1950s through the 1990s, estrogen was one of the mainstays of treatment for breast cancer. So it would be similar to someone with lung cancer getting offered a pack of cigarettes to treat their lung cancer. If it were true that estrogen caused breast cancer, but obviously it's not. So a recent study done in 2016 actually looked at using high-dose estrogen like it used to be used to treat breast cancer, and it basically showed there was really no meaningful difference between estrogen, tamoxifen, and aromatase inhibitors, which those are the current mainstays of treatment. So what happened? What happened? Well, the WHI study is what happened. That was a study that made headline news in 2002. Basically, the headline that was shown was hormones increase women's risk of breast cancer. So that happened, and those headlines went out. Millions of women immediately stopped their hormones thinking it increased their risk of breast cancer. Well, that study was funded by the NIH, the single largest study ever funded by the NIH. $1 billion is ultimately what it cost, and it was the largest trial ever done on estrogen. However, it was Prempro. So that is estrogen and synthetic progesterone, so not bioidentical. Ultimately, in hindsight, the study was halted by 3 people who were the safety committee who, looking back, they had obvious bias against hormone therapy. So that headline, hormones cause breast cancer, actually was shown to even not be statistically significant, yet there was nothing in the press to reflect that. So that incorrect message has been propagated since 2002. So ultimately, women who only took estrogen and didn't take the synthetic progestin had a lower risk of breast cancer than a female taking placebo. Where were the headlines? Estrogen lowers your risk of breast cancer. Nowhere to be found. Also, this study was representing synthetic hormones, Premarin and Prempro, not all the hormones. It was not a class effect. And interestingly, women who were on estrogen at the time of diagnosis had a 40% improved survival rate if you were actually taking estrogen at the time of diagnosis. And additionally, estrogen has other benefits as well. It lowers your risk of dementia, hip fractures, heart attacks, and improves overall survival. And if we think about women in their 60s, there are 2 women being diagnosed with dementia to every 1 woman being diagnosed with breast cancer. Breast cancer is 90% curable. Alzheimer's and dementia is 0% treatable. And if you take estrogen at the time of menopause, there's up to a 70% reduction in dementia. So we need to stop this misconception that estrogen causes breast cancer, because it doesn't. And in fact, the largest randomized controlled trial ever done shows it lowers risk of breast cancer. Thank you. Questions?
So Gail, what happens, you said at the time when you're menopause, then if you start doing hormone replacement therapy, you lower your risk, but what if you wait 10 years and you start doing it?
So if you wait 10 years and don't take Prempro, the data would suggest that Prempro started 10 years after menopause, slightly increases risk of clotting. But to give you an example, like it triples it. So if your risk is 3 in 10,000, it goes to 9 in 10,000. So even that is overblown with Prempro and Premarin, but use of estradiol and progesterone does not have that risk. So is it best to start it at menopause? Absolutely, when you have healthy endothelium, healthy vasculature, but it's like, I personally don't have an age limit in terms of starting hormones for patients, depending on what they're after. And women should get to choose what their risk tolerance is. We shouldn't be deciding that for them. Yes?
Is it reasonable to take a hormone level to be at the, say, a level of a 36-year-old so you could feel like a 36-year-old versus a 60-year-old that's plummeted and have none or hardly any?
So there's nothing healthy about menopause, and I'm going to pick feeling like a 23-year-old. Is what I will pick. In general, it makes sense to consider putting the hormones back that you used to have. Like when you were your healthiest in your life, you would balance out those hormones at that time. Being normal for your age when you're 65 isn't necessarily healthy. So yes, I would suggest balancing those hormones out, more reflective of a young, healthy person. Yeah.
Does insurance in general cover hormone therapy for postmenopausal women?
So currently, it is estrogen and progestins are FDA approved for the prevention of osteoporosis. So in theory, they should be covering that. There is so much negative press, and insurance in general does not want to cover anything they don't have to cover. So in general, micronized progesterone and estradiol are relatively inexpensive. They've been generic for quite a long time, compared to, say, some of the osteoporosis meds, which are $10,000 a year. So it's all a matter of perspective in terms of the cost, but I wouldn't count on insurance necessarily to cover that. Yeah.
Is that an oral or transdermal estradiol?
So oral estradiol is what effectively lowers your cardiovascular risk. Transdermal estradiol doesn't really do that. So if you're only after treating, for instance, your osteoporosis, then transdermal would be okay. But cardiovascular risk reduction and stroke risk reduction are really with oral estradiol. Thank you.